Hi, everybody. Thanks for joining today. We're going to go ahead and get started in the interest of time, and just know that it will probably have some people continue to join, and that's just fine. But we know you all are busy folks, and our presenters are busy folks too. So we'll go ahead and get started today. My name is Deb Kazmerzak, and I am with the Iowa Association of Rural Health Clinics. Really happy to be with you today and to offer this opportunity. I'm the one that sends all the emails out. Hopefully it's not like all the emails, but hopefully it's all the good emails. So kind of the face behind the association, but State Public Policy Group is an organization based in Des Moines, Virginia, and Hannah are on today. And they are also on the team and provide staff support to the association. So just wanted to introduce ourselves. So you are here today to learn about dementia prevention. And then also there's an opportunity for your patients, training opportunity. And this is, you'll hear more about it during the webinar, but an opportunity to roll out this training across the state to interested practices or local organizations to offer this training course for your patients. So I'm really interested in this topic personally, and I know it's just a growing issue everywhere. And I know especially in rural Iowa. So really glad that you're joining us today. So we are recording this. You will be able to access the recording if you've got colleagues you want to share it with. We'll make it available on our website at some point, but if you have a need for it before then, feel free to reach out to me. And if you would please just type your name and email into the chat, then that helps us kind of know who's on and with us today. So our presenters today are Mary Kelly and Dr. Patricia Quinlisk. Really happy to have both of them with you today, and I'm not sure who's talking first, so I'm just going to turn it over to Dr. Quinlisk and Mary, and thanks again for joining. Thanks, you guys.
Thank you. Yeah, and I'm glad to be here today with all of you. I worked for the public health department for many, many years, and then retired about 4 years ago now. And I know that I've seen some of you or interacted with some of you while I was working at the state health department, and I recognize some names. So hello to everybody that I knew before, and welcome all those people who are new acquaintances. But we're glad that you're here today. One of the things that, as I was getting ready to retire, my mother was diagnosed with dementia. And being a public health person, the first thing I thought of is, gosh, is there anything that can be done to prevent this or help my mother? And then since my grandfather on my father's side had it too, to be honest, I was a little bit selfish. What can I do to reduce my risk of dementia? And anybody who's had a family member with dementia, I think understands that it's not only incredibly hard on the person who's got the dementia, but it is an incredibly difficult journey for the family to go through with them as the person progresses in the dementia. If you go back about 20, 30 years ago, nobody was talking about preventing dementia or senility as they talked about it. That's what my grandfather was diagnosed with. But actually, there's quite a bit that can be done. So we're here to talk to you today a bit about what can be done. But as anything that makes our health better, it's not things that are just easy magic pill, one and done kind of thing. So as I and others were looking at trying to help prevent dementia, we started realizing that it's not going to be just giving out information. You can go online and Google it and get all the information you want, but that's, well, as we all know, information alone usually doesn't change behavior. So we got together with the YMCA, and then great Mary Kelly got hired, and we are now trying to put together basically a nonprofit in the community program that anybody can pick up and drop into their community and help the people in their community to reduce their risk of dementia. So that's what we're going to be talking about today is the program. It was once called Saving Your Brain. Because of copyright issues, we couldn't use that anymore. The football players with concussions had basically grabbed that name. So we are now unlocking brain fitness, keys to preventing Alzheimer's, dementia, and other cognitive decline. And I'm going to be talking about what those terms are and what they mean in just a minute. Is the arrow? I'm going to get rid of this. Get that up there so I can see. Okay, so I'm going to now show you basically a slide presentation that we put together. And by the way, this is available for communities, so you could use our slides to go to your hospital, your Y, your senior citizen center, your whatever in your community you think might be a partner, if this is something you decide that you want to be part of in your community. So let's talk a little bit about how we can indeed prevent dementia. Oops, use the arrow down. Yeah. Let me just try one thing. Sometimes, at least on mine, yeah. Well, I think I'd like to just start with saying dementia is not a normal part of aging. A lot of people just think, oh, well, if you live long enough, you'll get dementia, and that actually is not true at all. Dementia is like heart disease or lung disease or something. Yes, as you get older, maybe your heart doesn't work as well. But most of us are going to have a pretty good heartbeat until something knocks us off and we die of something. But dementia, again, is not a normal part of aging. So what we want to do is talk about what we can do to ensure that no more people get dementia in our communities. So let's just talk about what's the cause of death. And I just picked women here. But number 1 is heart disease. Number 2 is cancer. Number 3 is Alzheimer's disease. It's number 5 in men. Probably part of that has to do with women do tend to live a little bit longer, but part of it probably has to do with susceptibility. Women are more susceptible to this. Now you might say, well, this is just Alzheimer's disease, and that's true. Alzheimer's disease is somewhere around 70% of all dementias are Alzheimer's. If we would put that other 30% of all the other kinds of dementia, dementia would probably be the number 1 cause of death in women in Iowa, and maybe 2 or 3 in men. In fact, right now in England, it is the number 1 cause of death in women. So bottom line is this is a serious public health problem. And then when you add on to it, people typically live for years with dementia, and the incredible burden it puts on their families and just the sorrow of watching somebody go through dementia. It's just something we would really, really like to impact and see if we can get rid of, or at least reduce. Whoops. Sorry, I did hit the. Let's try that. Okay. The other thing I just thought I'd do is sorry, get rid of that. Just show you why all of a sudden dementia and Alzheimer's disease has become an issue. If you look at diseases of the heart over the last, say, 50 years, it's gradually gone down. A lot of that is because of efforts to get people to stop smoking. Cancers or malignant neoplasms are sort of staying the same. Cerebrovascular disease has gone down a little bit and everything. But when you look at Alzheimer's disease, look at how that has skyrocketed. We don't know why that's occurring. It could be just, to be honest, better diagnostics, things like that. But the bottom line is this has increased over the last several years and is truly something that has gotten on most people's radars as something that needs to be addressed. If we look at cognitive impairment, which is basically the first step of going into dementia. Cognitive impairment is when somebody themselves says, I can't think as well as I used to. I can't remember things as well as I used to. But they're still able to live independently. They're still able to compensate. You know, maybe they can't remember their grocery list, but they basically just stop trying to remember it and make a list on a piece of paper so they can compensate for being cognitively impaired. Once you go into dementia, though, you really can no longer compensate. You now need another person, a caretaker in your life to take care of you. Or, as we did with my mother, we put her into a special place where she could have nurses around her all the time, taking care of her while she still lives semi-independently. So right now in Iowa, it is estimated that about 9% of adults who are only 50 years of age and older perceive themselves as being cognitively impaired. In other words, I'm having trouble remembering things that I used to remember just fine, or I can't figure out how to multitask as well as I used to, or I get in the car now and I get lost, or things like that, where they're just not doing things that they could do 10, 20 years ago. About 20% of Iowans who are 18 years and older perceive, again, cognitive impairment enough that they have had to give up household activities. They can't go to the grocery store by themselves. They can't get in the car and drive to their doctor's appointment by themselves, etc. They're changing their life because they recognize that they cannot do things as well as they used to. Unfortunately, 80% of these people have not talked to their healthcare provider about it. So all of you who work in sort of the rural clinics, you think about that. 80% of the people who probably need some help with this have not mentioned it to any of the healthcare providers. Then about 30% of these, 35% of these people live alone. So they don't have somebody who can help them with dealing with this. And just to put this in perspective of what we're dealing right now with COVID, there is a lot of concern that COVID causes, of course, we know causes long COVID and brain fog, etc. There's a lot of concern that this may increase the risk of getting dementia later on, and we may be going into the next 10 or 20 years of having high rates of dementia in our communities because of the people who have gotten COVID. So what are the risk factors for cognitive impairment and dementia? Well, increasing age. Unfortunately, that is one of the strongest things. There is a specific gene, one of them is called the APOE4 gene, that does increase their risk of getting dementia. But right now, here, I'm going to tell you all the things that we talk about later on here about the course that we teach and everything. The science suggests that the impact of the gene that puts you at high risk can basically be negated by doing the things we talk about in this group, and brings your risk basically down to somebody who does not have a genetic susceptibility to dementia. So that's the good news. It's not an absolute gene. It can be modified with the things we'll talk about a little bit later. If you have chronic diseases like diabetes, high blood pressure, COPD, etc., that also is known to increase your risk. Smoking, like everything, increases your risk. Having a poor diet, high blood pressure, high cholesterol, lack of physical exercise, and lack of mental stimulation and socialization. So you can see that there's things on here that are able to be addressed even if you're in your 60s or 70s, such as getting good control of your chronic diseases, increasing your physical movements, increasing mental stimulation, socialization, etc. So those are the kinds of things that we really focus on in our class. What are the biological causes? Well, if you've looked at things like Alzheimer's, you've probably heard about plaques and tangles of proteins in the brain. In fact, that drug that came out about a year ago that cost $60,000 a year, one of the things it was supposed to do is to decrease the settling of plaques and tangles of the proteins in the brain, even though the drug had not been shown to change your risk of dementia at all. By the way, that drug's now been pulled off the market and is only available in study situations where somebody's doing an experimental study to see. Other biological causes are small strokes due to blood flow problems. Another one here is concussions. So when I talked about the football players, that's really the place where they are having most of the impact on their risk of dementia. Shrinkage of a part of the brain called the hippocampus, which is incredibly important for memory. If your hippocampus doesn't work, you have no ability to make memories. So every moment is totally new to you, as if you were just born, which is just a horrible way to live, obviously. If you have an enlargement of your brain's fluid spaces, these are called ventricles, that can cause dementia. Reduced use of glucose or sugar by the brain, and that's why diabetes increases your risk of dementia. And decrease in brain transmitters, which are called, or messengers, which are called neurotransmitters. The place in our society where that comes into play is there's a lot of drugs out there that we prescribe to people, or you can even get over the counter that can really increase your risk of dementia, which people, including, I'll just say it, a lot of healthcare providers are not very aware of. The bottom line, though, is there is no medication, nothing known to cure dementia at all. There's no magic pill. In fact, there's not even a magic pill that will lower your risk. The way it's put by Mayo Clinic is current Alzheimer's medications can only help for a time with memory symptoms and other cognitive changes. Most of the drugs at places like Mayo Clinic give you only work for about 6 months to a year, and then they lose their effectiveness and you're right back to where you were. So let's get into talking about what does work to prevent dementia. Well, a lot of things. We can indeed lower your risk of getting dementia by a significant amount. In fact, right now, the current science indicates that an individual can reduce their risk of cognitive decline, dementia, Alzheimer's disease up to 70%. And the Centers for Disease Control estimates that about 40% of all the dementias in our communities can be prevented. Those are huge numbers. So there's a lot we can do, though. If you ask Joe Blow on the street, he goes, well, I'm just going to cross my fingers and hope I don't get it because there's nothing you can do. Well, there's a lot you can do. So how do you reduce your risk? Well, here are some of the basic keys to reducing your risk of dementia. Eating well, and we'll talk about what that means, get moving, staying sharp, being social, making sure you sleep enough, address any chronic disease you might have, to ensure that it's under good control, reduce your stress, hear well. Believe it or not, hearing is as they say in England, the single most easily addressed issue that increases your risk of dementia, because all you have to do is put a hearing aid on. And then avoiding bad meds. Like I said, there's medication you buy over the counter that can substantially increase your risk of dementia. So there's a couple other things that probably come into account a little bit more in some of the other areas, such as in a clinic or something, to help people stop smoking, again, getting good control of their chronic diseases, helping people sleep well without medications or with only medications that are good for older brains, staying hydrated, making sure that you have good preventive health. These days we talk about not only the COVID vaccine may reduce your risk of dementia, but we know the flu vaccine does. Good health checks, so you find out if you've got high blood pressure in time to do something about it. And then a good microbiome. I'm not going to talk very much about that today, but having good bacteria in your gut probably really does impact your risk of dementia also. So one of the things that we did before I left the health department was, and it's been updated since then, we have a quiz that anybody can take, including all of you. You just go to the Iowa Department of Public Health main website, just scroll down on the whole page till it says Saving Your Brain, click on that, and then click on Take the Quiz. It takes probably somewhere around 15 minutes, and it goes through all of the things that put you at risk of dementia and basically asks you how you're doing on it. We don't store the answers, so you'll need to write down, either print out your answers or write down your score. But it will basically say you're doing really well on, for example, being active, but boy, your diet is lousy. So here are the things that you might start working on. What we recommend people do is take that quiz, work on the things that they got low scores on, and then a couple months later, take the quiz again and see if you've reduced your risk of getting dementia. Okay, So here's the website for the Iowa Department of Public Health. Again, you can see where it says take the quiz and just go in, and anybody, this is free public domain. It's on the public health website. Anybody can take it and see. And by the way, not just the Iowans, but anywhere can take it and just see how they're doing on reducing the risk of dementia. And I will just say, this doesn't determine what your risk of dementia is. We don't have any way of doing, say, a blood test or anything like that to find out really what your personal risk of dementia is. Our science is not there, but the science can tell you, regardless of what your risk is, how well you're doing to reduce that risk down to hopefully almost zero. Okay, so I'm going to now turn it over to Mary to talk about the course that we put together to help people do what they need to do to reduce the risk of dementia.
Sure, thanks, Patty. So Patty has been giving this course after she retired for at least 4 years, and it is a evidence-based course, and it was developed with Dr. Quinlisk, Dr. Shaw, and
Dr. Lizzie Wendell, who now lives in Utah, but it was put together by a bunch of people who have, to be honest, some personal concerns about dementia, but then we had great partners in Iowa Department of Public Health, the YMCA, Alzheimer's Association, Broadlawns Hospital here in Des Moines, et cetera. So it really is a lot of people coming together to really trying to put something together that can be available in all communities at a very, very, very reasonable price, and that it is not for profit. By the way, you can go online and find lots of places where you can spend thousands and thousands of dollars getting exactly the same information we teach here, but we don't charge that much at all.
And these doctors put together, they took the World Health Organization information, Centers for Disease Control, a lot of other reputable research organizations, and they looked at the modifiable risk factors, many of which Dr. Quinlisk already has mentioned, and they put it together in a 10-week course. It's very similar if you're familiar with the diabetes self-management course or the Walk with Ease. So it's 10 weeks group, and we call the attendees participants because it's really important that they participate in the program. So we meet once a week, and the class is for 2 hours. And then there is some homework because there is goal setting that is expected after each class. So we call the modifiable risk factors keys. And so we discuss 1 to 2 keys each week. And we have named instructors, we call them course facilitators. And then we have the guest experts. And that is a pharmacist who's familiar with geriatric medicines, a dietitian, a fitness professional, and a health and wellness coach, and an audiologist. Mm-hmm. And so each of the participants set weekly goals, and we are big on adult behavior modification and the encouraging, and it's a peer group. We have 8 to 15 participants in each course. Then each of the participants get to meet individually with the dietitian, the pharmacist, wellness coach, and fitness pro, and they get one-on-one sessions. And so they'll go over the food plan. The pharmacist, will have the participants fill out taking the medications over the counter and prescribed, and any supplements. Yep. Supplements are big. So, and then the wellness coach, and that kind of puts everything together. And then the fitness professional, and that's where the program needs to be somehow associated with some type of exercise. Our website that we have, and I'll show you the website address in just a minute, has some exercise videos that are available for sites that might not be connected. Like right now, we are running this mainly through YMCAs, but we have other assisted living who have their own exercise place. Healthcare centers, a lot of times the hospitals, I think Mary Greeley has their own exercise facility. So somehow it's connected with that. And then we have healthy food snacks that we introduce each week. And I call them more bites. Can I take one? Yep. So right now, after we're done with this seminar, we are going to have, I don't know if you can see it, but we're having, we're having a session on a healthy foods or a brain health session with exercise at the Y after this. It's not a Keys program like we're discussing right now, but I call them like snack and bites and it would be examples.
What's in it. Because we try to get people to eat things that are maybe not that they're used to eating. This is our green snack. It has a piece of seaweed, which has iodine in it, a piece of dried cauliflower, some peas with wasabi, and some soybeans or edamame. All of them are finger foods, all of them green, all of them easy to eat. But a lot of people have never tried any of these. And yet, I'll just tell you, in our classes, we do have edamame as one of our snacks. People are surprised. I really like this. And we come from a state where soybeans are grown in almost every field. So anyway.
So each week we have a healthy snack that we have included in the curriculum, and we give how to prepare it, and then there's a little history on it or a recipe that the participants can take home. And then again, the 10 weeks of online fitness classes. And then at the very first class we have all the participants take that Save Your Brain quiz with the Department of Public Health. We have hard copies of it. And then we have them take it at the first class and then at the last class. So then they can see for themselves how much they've improved after they've been setting their weekly goals and sharing their weekly goals. And then on the third class, we do fitness exercise. Oh, second class, sorry, okay.
Yeah.
So the second class, we do the fitness. I organize the things in weeks. I'm a tech person.
Well, we change things around a little bit too, but yes.
So, and we do it simple, like a chair sit or standing on one foot, so just very simple, but they're all based on CDC guidelines. And so this way we can, again, it's another measurement as far as reducing their risk for dementia. And then after the program ends, we have monthly chats. And so sometimes they're in person and sometimes they're on Zoom. And there's been different, I'm a dental hygienist as well as a dementia practitioner. And so one time we had a chat on oral health. Other times we had on how to use walking sticks. And the walking sticks one was in person, where the oral health one can be done on Zoom. So
it's just a way of keeping people involved in the program. And a lot of the people in a class, particularly before COVID hit, actually became sort of a group, and they continued to meet for coffee or to take a walk or whatever, even after the class ended, which is something we really encourage, because obviously after 10 weeks is not going to be like you're going to live a perfect life and everything's great until you die. No, we know as adults we need continuing encouragement, support, help from our peers to continue the healthy lifestyles and to just keep up to date on things, because I'll just tell you, the science behind dementia prevention is changing pretty much every day. There's more and more science being done and more things that we learn. So I'll just tell you, the last couple of weeks I've learned that they're now seeing that vision is a very important thing to be to ensure you can see well, because if you can't, it increases your risk of dementia.
okay. So this is part of what we're doing today, is not only informing you about dementia and the resources that are available, but also trying to recruit you to refer some of your participants. We do have some classes that are online, and we are developing prescription pads that if you request them, and my information will be in one of the last slides, and also Deb can distribute my information. But it's a prescription pad on if you have anyone that is concerned about dementia, and it gives the resources. And I think we have 3 or 4 resources, and our program being one of them. We're recruiting the sites around Iowa. We have IDPH COVID-19 funding to expand the program. And so we are doing that. And we know that this course is not covered by insurance. I think that might be a hope someday.
Yeah.
But there is a website. So we're looking for program hosts, but also for people just to promote the program as a community service.
Yeah, I was just going to say, one of the nice things about working with places like the YMCA is they usually can have some, I don't know what you call, they can make the cost proportional. By the way, if you're thinking about the cost to put together a program and get all of the professionals and have the snacks and all of that is somewhere around $200 to $250 per person per course. Now, we've been very lucky. We found a lot of volunteers who will come and do things such as our pharmacist works for Broadlawn. Broadlawn's basically donates her to the class. We don't pay her, but somewhere around that. But we do know that that is a bit of money for people in the community to pay for. So we do have some scholarship money for people who just need some help. And places like the Y can do sort of a income and do a proportional cost so that people can take the course even if they are low income. But I will tell you, we make everybody pay something for the course, because that's part of adult behavior modification, is that you have to put some skin in the game. So about the lowest we charge is $20. If we know if we gave it free, people sometimes would then just blow it off and not come or not feel serious about making the behavior changes. So we have to charge something. But again, don't let the cost stop you. We've got resources to help. And I know that sometimes in your community, you can find resources, the local hospital or the Y or whatever, to help those people who cannot pay for the class to still take the class, because we know people, low income people, minorities, rural people living in rural areas are all at higher risk of dementia. And we need to make sure we have this program or these types of programs available to everybody.
Yeah, so again, the subject matter experts are the most expensive part of the program. You know, the snacks are really bites, and so there's a lot of cost control if you can get volunteers within your own community or within your own organization. And with this COVID-19 funding that we have, we also are actually giving each program that wants to host it $2,000 to help host it. And it would be coming with we would train your program facilitators and course facilitators and give you all the program materials for free for at least the first year. As we update it, we might have some other, there might be some future minor costs, but the YMCA of Greater Des Moines and Dr. Quinlisk are really dedicated into making this affordable for everybody to put on. And so, and again, that's where our funding that we're actually paying you to host the program, at least initially.
Yeah.
Stop sharing.
Oh, do you want me to stop sharing?
Sure.
Okay, did everybody get the things here? Okay, what we'll do is we'll stop sharing the slides and see if people have questions. We sort of blew through that, I know, rather quickly, but we wanted to make sure we sort of covered the top issues. And I would like just to say, as a physician, we know that physicians, nurses, PAs, respiratory therapists do not have time to do a lot of individual behavior change kind of coaching. So that's why we put that prescription pad available and are making it free to any of you. So you could get the prescription pad, and you have somebody who comes in and says, my mom had dementia, I'm really concerned. You take the pad, and there's Alzheimer's Association for people who are caregivers to get support for themselves. Caregiving is incredibly hard, taking care of these people. It also has places like the IDPH quiz where people can go and say, what is my risk, or how much of my risk am I reducing? You can go to our website, which Mary is going to show you, where you can see what classes are coming up. And we do classes in person around the state, but we also think we're going to pretty much always have one or two on Zoom for people who either don't live in a place where there's a class, or have transportation issues, or just don't live in Iowa or something. We've had people in Indiana, California, and Colorado take the course. So we have lots of those kind of things available too. So anyway, well, let's, do you want to show the website first, or do you want
Actually,
to?
why don't we
Do the
do
questions?
the questions, because I'll have to pull up the website.
Yeah. And this is,
The questions so far have been from me. And
Okay.
you actually answered one, Dr. Quinlisk. I think I saw the same news, well, maybe not the same, but I saw a news piece about the vision care as well, the vision health having an impact. It seemed like maybe the numbers weren't as high as some of the other factors, but I thought that was really interesting and wanted to know that I heard that correctly. And then I just had another question in there about, if you don't have a Y in your local community, in your rural community, what do you think other good sites for offering this course are? I mean, we have rural health clinics, which I'm guessing don't have an overabundance of space for classes and that kind of thing. So they might need to, you know, partner with someone else. So just kind of your thoughts on those kinds of partnerships.
I think there could be a lot of places, libraries, and we talked about that earlier, churches, senior citizen centers, you know, even like the local school who has a big classroom available in the evening. There could be a lot of places. I don't want anybody to feel restricted. All you really need is basically a space where people can come together. And again, it's only about 8 to 15 people. So we're not talking about a huge space where they can come together for those 2 hours. And then somewhere in the community, there is access to something that you as a course can encourage people to do some kind of activity or movement. We don't really like the word exercise because that makes people think I've got to put black spandex on and go sweat at the gym. No, we're really talking about things as simple as walking around the block or walking around the lake or getting on your bicycle. I mean, there could be a lot of things you can do as a class. And I will just say the one thing we don't want to do is we do not want to have to say rent an expensive place and then partner with a for-profit fitness center, and all of a sudden now the cost of the course is $1,000 because of that. We really want to find public spaces that maybe we can get at no cost or a very low cost. We can have fitness things that are available basically for free, or again, a very low cost, or even a sliding scale like the Y does, something where we are not creating any barriers, especially to the people in our community who need this the most. I'll mention one other thing. We've actually also had husband and wives take the course together, and we've had children, adult children, with their parents take the class. So we don't want to exclude people like that, but I will say there's one group of people we do exclude. We cannot take people who already have dementia. There is no science that says people who already have dementia will be benefited by anything we do, and they cannot take the class because they can't set goals, they can't do the homework, they can't. So unfortunately, we will not take people who already have dementia, but we will take people who have mild cognitive decline, because there is some science that says some of those people not only will benefit by not getting worse, but some of those people actually get better and may even go back to normal with some of the things that we teach in this class. So mild cognitive decline, take the class. Alzheimer's disease.
I think the GERD medicine. Talk a little. Oh, I was going to say, talk a little bit about the medicine for GERD that it's one of them that it's meant to be taken like one of the anticolon.
Oh, you're talking about the medicines.
Yeah, medicine.
I'm sorry. Yes, I will just say I'm going to tell you a story. About 3 months ago, we were doing one of our walking clinics where we have everybody come and we get to the Iowa Cubs parking lot, and we had poles and teaching people how to use poles because it does the upper body movement as well as the lower body. And we had a person who was taking our class at that time came up to me, and she said, I just wanted to let you know that one of the reasons I took this class with my husband was because he was showing signs of pretty significant cognitive decline, even to the point where I was looking for what care centers were available in my community if I had to basically put him into care because he couldn't carry on a conversation, he couldn't remember anything, etc. But she said, we sat down with a pharmacist and she found out that he was taking Tylenol PM. PM means diphenhydramine or Benadryl. And that is one of the absolute worst drugs to take if you're older because it's an anticholinergic, and your brain uses choline to basically transmit thoughts in your brain. So by taking an anticholinergic, you are creating barriers all across your brain to be able to remember things or to think. And she said, so after we met with the pharmacist, we immediately stopped him from taking it. He was taking it to help him sleep. And within 2 weeks, he was basically back to normal, had conversations, could remember things, and she was no longer looking for assisted living places to put him. And that's based on one over-the-counter drug. So there's a whole list of drugs that we tell people don't take unless you really need to. And our pharmacist works with them to look at the drugs that they're taking, not just prescription, over the counter, and some supplements, and works with them to get them off the bad ones and maybe to use something else that is better for their brains. So anyway, that's just an example of how this course, I think, has really impacted some people's lives, something as simple as that. And I'll just tell you, we've also had wives who have been trying to get their husbands in to get a hearing test for years. And their husband says, no, it's just because you mumble. Well, we have a doctor of audiology that we work with, and she will do audiology tests for anybody free of charge. People have gotten their spouses to go take that, and they found out that no, they have significant hearing loss. And they've gotten them on some of these newfangled hearing aids, which are not like the old ones at all, that work with your Bluetooth iPhone and are really, really great and work well. And now they're, the wives are no longer mumbling. And of course, then it also reduces the risk of the husbands getting dementia later on. So again, lots of things I think that we hear that people really got some good benefits out of this program. And of course, we don't know if we're really changing people's risk of dementia. We hope we are, but the bottom line is the stuff that we teach in these classes are good for physical health too, for heart health, for lung health, for whatever. So it's just a good mind and body, healthy living kind of programs. So hopefully we're doing something to reduce the risk of dementia, but meanwhile, they're going to be a lot healthier too.
Well, I just have all kinds of questions, and the list keeps growing the more you talk. So I'll ask a few, but everyone else feel free to unmute yourself or put something in the chat. Your questions are more important than mine. So you just were talking about the medications. Is that list of medications somewhere?
List that we have, most of them are on something called the Beers list, which is available only to pharmacists. It's a professional list, but it certainly is available to any licensed pharmacist. Certainly you can go online and look up anticholinergics and things like that. But I'll just tell you, the list is like pages and pages and pages. Yeah. We'll only use the scientific name, and most people only know the generic name. So that's one of the reasons we just said, no, we're going to give you a talk about these drugs, but then we're going to have a pharmacist sit down with you and every drug that you're taking to make sure that you get personalized attention to whatever drugs it is you're taking. Because sometimes people need that drug, but they can change to a second or third generation that doesn't have the anticholinergic effect. And so they can be switched, and the pharmacist can work with their healthcare provider or whatever to try to get them on a better medication or maybe a better dose or whatever to decrease their risk of future dementia.
Mm-hmm. Thank you. And then I wondered if two questions about referring people into the training. Number one, is there an ideal age? Like at what point when you have a relationship with your patients, should you start to talk about these things? And is there an average age or?
Well, if you look at the science, to be honest, the sooner you start, the better. And they're talking about starting in elementary school kind of things, of getting a good education to really get all the neurons made and all of that early in life. Realistically, though, we don't really have a lower age cutoff, but I will just tell you that almost everybody who takes the course is, say, 55 years of age and older. But we have made exceptions for like the child of the parents who live with them. The child wanted to know what was recommended to help the parents do what they needed to do, since that child was basically in charge of meals and stuff. So we make exceptions sometimes too. So we don't have an absolute, but we find that the people who are most concerned about this and most likely to take our course are sort of 55 and older. But we don't have an upper limit. As long as they're still cognitively intact enough to take the course and get benefit out of it, they can take the course.
Yep, thank you. That makes good sense to me. And then you mentioned that sometimes there's online courses. So say a rural health clinic wants to start referring people, but doesn't have the, everything worked out to start offering it locally yet. So how would they go about finding an online course, or maybe that's what you're going to do on
It's
them?
done out of the Des Moines area wise with one of our instructors and with our pharmacist and our dietitian, everything, and just the whole thing is done over Zoom. So they have to be able to do Zoom. So they have to have a computer, and they have, have to be able to do that. But once they got Zoom and a computer, really anybody anywhere in the country can take it and can be referred. And I think Mary's going to show you now, sort of, if you go to the website.
And are you seeing the website? Did I
Yes.
share the right page? And so right now, we're still adding on the courses, but these are the 3 places, plus the Greater Des Moines YMCA, and the Zoom classes will be listed here. And when I make this live, it will be clickable to write to that specific program's registration page, which will have that for the Zoom listing as well.
One of the things Mary's working on is the grant we got is to expand to somewhere around 30 more places around the state of Iowa over the next year. So even though we only have 3 on there right now, I know Mary is working hard to identify more sites and have it. And again, just to reiterate what Mary said, we're not trying to make any money off this course. Most people, myself included, volunteer completely for everything. And therefore, if somebody wants to become an instructor and have the course in their area, we will give them basically the training, the course materials and everything. And I believe it's pretty much at cost for them, and so that they can pick up the class and do it. And we want to expand this because we really feel it's important to get as many people who want to work on healthy living and reducing the risk of dementia. We want it to be available to whoever. And I'll just say, we've had people who are actually in a rehab center take the course over Zoom while they're in rehab, which is great. More power to people. Let's have it available.
And Mary, you mentioned the $2,000 stipend or whatever, so that could be used to offset those costs, kind of those startup costs.
Exactly. Right now, all the materials, the curriculum, and the training are all for free. Plus, we give you the $2,000 after you host the class. With there's some parameters with that, but yes, that is really just for hosting the class. You get that, and that does offset most of the costs.
Okay.
Not all of them. So what else? I can show you a little bit of the website unless you have more questions, Deb, which we're happy to answer.
I'm sure I could think of more. So if somebody wanted to learn more about how they could go about, getting connected, they should just email you, Mary, is that?
Exactly. Yes, I have a recruitment package if you want to if you want to host the class. We're also looking just for community partners to promote that, or to maybe give the presentation. And we have this
Pretty much the thing. We have a similar one where you can take what we just went through, where you could go and present at your local hospital or your local church or your local library, where you could say, here's the program, here's why we think this is important, here's some basic information. Would you like to become a partner with us?
And then there are host sites in the community. As you said, we've been working with local public libraries. Some local public health departments are hosting. They're just not listed yet because they haven't gone through the training yet. And so we're looking for promotional partners that then they know who they could refer to. We have posters that places could hang up in their areas. So we're looking for that type of program or partners as well.
That'd be a good idea too. RHCs just to put posters up in their waiting room or something, and
absolutely
just access it on their own.
That's another way. Yes, exactly. So let me just press on one of these keys so you can see we're calling it kind of a teaser or one pager. And okay, here I'm just going. Okay. So then it says eat well, and it gives a couple paragraphs about how eat well can change your risk for dementia, and then more information when you take the class. So, but each of the 10 keys has a teaser like this. So,
and once you become an instructor, you can go to the same website and we'll have a lot of the information, resources and things on the website. So it's hopefully is about as easy as it can be for some place to become a site for this, and then to get all of the information. And we've got the tools that you hand out to the people to help them keep track of their diet, their exercise, posters, more information, nutritional information about the snacks that you provide, so people can find out how many calories it has, what the vitamins are in the snacks that we give them, things like that.
So yeah, this is just what the secured program facilitator website looks like, as far as all the curriculum with the PowerPoints, handouts, everything you need to host the class. And we did pilot this in a year ago in 3 different YMCAs around Iowa. Okay.
I'm sorry, I need to go start a class. It was nice seeing you all. If anybody has any questions for me, just send them to Mary and I'll do my best to get them answered.
Thanks,
Thank
Dr. Quinlisk.
Thank you, Patty. So yes, we piloted last year with other program wise in Des Moines. And one of the things, it was well attended. No facility had fewer than 15. They actually had waiting lists, and they've each conducted every program. And I even have data, I didn't have it right in front of me, as far as the before and after taking the quiz, and how the dementia prevention quiz with the Department of Public Health. And it was just incredible, the amount of people. They moved, over half of the people, actually 75% of the people moved from like the worst of the healthy behaviors and shifted to the top 2 categories of the healthy behaviors and healthy lifestyle. So
that's great. And so you mentioned facilitator training, like how long is that? What's the kind of time commitment to get something running?
There's 2 of them that are online. The first one is an hour and a half, and it's an introduction to all the curriculum. And then we have a 6-hour in person that's held in Des Moines, and then another post 1-hour training. So total of about 8 hours of training, and mostly done online. And then we'll have a Facebook group that is for the program facilitators to ask questions or to talk about successes and difficulties.
Mm-hmm.
And as well as we'll have, for at least the first year of the program, we'll have monthly chats online that they can join and go over curriculum.
Mm-hmm.
So, and we have a cohort starting next week. If someone's really interested, I can catch them up to starting next week. And then we'll have another one starting in the fall, and we'll probably have a 3rd one starting a little bit later and stay in the winter.
So the process would be get in touch with you, say I'm interested in this, or I'd like to find someone in our community that might be interested in this. And then we, depending on the timing, slot that person into whenever you have a training cohort starting, like the next training cohort.
Exactly, yeah. And we try to encourage we call them program facilitators, who's overall the administration of the program. And that could be separate or the same as the course facilitator, which is the instructor. And we always try to encourage to have at least 2 course facilitators. You just don't know if someone's, illness or staff changing, which I'm sure we're all too familiar with, to have some type of a backup plan. So.
It sounds great. We're getting close on our time, so I want to make sure I'm not monopolizing all the Q&A and see if anyone else has any questions. Feel free to unmute yourself or type it in.
Well, I really appreciate you allowing me to bring this information to your group, and for everybody, thank you for attending.
Absolutely. It looks like Jalissa, did you unmute yourself? Did you have a question?
And I might have missed this, Debbie. I might have just asked this exact same question, but I kind of just had a light bulb. For some staff that we've hired a second social worker for our organization to do some outpatient stuff in our clinics. Anyway, how did you say we would go about contacting you for additional information about do we just need to email you if we are interested in putting something together in our community?
Absolutely. Email me, and then I will send you a program information packet, and then schedule either a call or some type of chat, either live or on Zoom.
Okay.
And if you missed it on the slide or in the chat, I know Mary and how to get in touch with her, so I can put you in touch with her too.
Excellent.
Well, thanks, Mary, and please thank Dr. Quinlisk for us again, and appreciate it a lot. And thanks for those who joined that are still on. People are getting ready for their 1 o'clocks. So,
Yeah. Thank you so much.
all right, thanks. Take care. Thanks, everybody.